Welcome back to Acadiana Live and part 2 of our Heart Health series with Our Lady of Lourdes. We have Dr. Safi Haq joining us again with more information in our Heart Health series. Dr. Haq, welcome back.
Thanks for having me.
Today we are talking about blockage. Again, starting general, what is heart blockage?
So heart blockage most probably refers to blockages within the coronary arteries, which are arteries on the surface of the heart that supply the heart muscle. The blockage can occur as a result of plaque buildup, which is usually material that's dense in calcium and cholesterol, or there can be clot or other foreign materials can cause a blockage. But by and large, the most common thing that we refer to with a blockage is plaque buildup within the arteries that's limiting the flow through the artery.
Now, how would someone know without getting a scan? Are there any certain physical symptoms that we would feel if blockage is occurring?
Generally, the symptoms that patients feel with blocked coronary arteries, they feel fatigue, they feel chest pain, they feel short of breath, they can have things like leg swelling. So those are generally the things that a patient would experience. The patient can also have a heart attack and find out about blockages that way.
Now, of course, you said a heart attack, so of course this is a very serious situation, but how serious is blockage, really?
So blockage exists, or the severity of it exists kind of in a pretty wide range. You can have anything from a 1% blockage that does not limit the flow through the artery and as a result doesn't compromise the muscle of the heart. Or you can have a near total or a total blockage where the muscle is severely starved for oxygen, it's not getting the blood and nutrients that it needs, and so that's when a patient has a heart attack. Even with heart attacks, there's a variety of flavors of heart attack, and so it can be not very severe or it can be fatal. So it all kind of depends on the situation.
Now, age or family history, what does that play in heart blockage?
So the natural history of the arteries on any of the surfaces of our heart is that they will build up plaque over time. So age definitely plays a big role. Genetics plays a huge role in the development of coronary artery disease and the implications of it. And then other things like lifestyle, smoking, diet, those things also play a role.
Now, what's an important age to maybe start checking on this, especially if it is in your family history?
We say about 50 to 55.
Okay. And what does that consist of whenever you do have something like that done to check on?
So the first thing you would want to do is touch base with your primary care doctor, get a physical exam, possibly see a cardiologist. The things that a cardiologist would look at would be an electrocardiogram, where we look at the electrical activity of the heart and look for any abnormalities there. You would also get an echocardiogram, which is an ultrasound that looks at the heart muscle and the function of the valves. Patients also get stress tests. There's different types of stress tests, but basically what a stress test does either has you do exercise and see if there's changes that indicate that the heart muscle isn't getting enough blood, or if a patient can't tolerate exercise, we can give them certain medications to stress the heart and see if there's indications that the heart's not getting enough nutrients and oxygen.
Now, for more information on this topic of heart blockage, or maybe our viewers listening have experienced some of the symptoms that you mentioned, how can they get in touch with you guys?
Well, for significant symptoms like chest pain, you should go to the ER. But if you want more information, you can go to lourdesrmc.com, or you can call our office, and we're always available and happy to help.
Our Heart Health series with Our Lady of Lourdes. We'll have another topic for you guys next week right here on Acadiana Live.